Obamacare was the target of the Tea Party-led government shutdown, and the media spotlight remains on the numerous glitches facing the Affordable Care Act's insurance exchanges. But on October 26th in Baltimore, protesters took to the streets in an attempt to change the conversation. Their message: access to quality health care is a basic human right.
My name is Ernest. Everybody in United Workers calls me Bear. It was important for me to come out here today because Maryland does not have universal health care. Our country does not have universal health care. I myself had to fight and go without health care for about 4 or 5 years, which I now have because I'm on SSI and I'm also a vet. But this country can be the world police. Why can't we have universal health care? Other countries like Italy, Germany, France have universal health care. We need to take care of our own here first, you know. And you've got people running around that don't have health care that have to decide whether they're going to pay for medicine or rent or phone bill. And that doesn't need to be so.
The event was organized by the group Healthcare is a Human Right Maryland, and activists used the opportunity to flyer and talk to residents about why they think everyone should be guaranteed access to health care. The march was met with a favorable reaction from local residents.
My name is Daria Miller. I'm a resident in the neighborhood, and I absolutely agree with them. Health care is a human right. It's a basic human right. Absolutely.
So right now it's not a guaranteed right. Obamacare is expanding coverage, but it's still going to leave 30 million people uninsured. Like in Maryland, it's like more than about like 300,000 or 400,000 people. Why is that a concern to you?
This country's rich enough for us to be able to have health care for every single human being. It's at the core of who we are.
And so they're part of a campaign to get universal health care, single payer in Maryland. Do you support that? And do you think that momentum might change in places like Maryland for that to actually pass?
I absolutely do, and that's one of the reasons why I like living in Maryland, because it is a catalyst of change for movements like this. So I absolutely support any movements like this, yes, for health care.
The march route included the headquarters of Care First, one of Maryland's largest providers of health insurance. It, along with some other insurance companies across the country, plan to increase rates on January 1st because they say President Obama's healthcare reforms will increase their costs. Care First has proposed to increase the cost of their individual policies by an average of 25%. Many participants of the march shared their own horror stories of not being able to afford health care, or like 20-year-old Brandon Johnson, who even with insurance faced extreme economic hardship when faced with medical problems.
I'm 20 years old. Around the time I was about 13 or 14, we had a lot of trips in and out of the hospital and in and out of the doctors. My stepmom's pregnant with a baby, so she was going in and out of the doctors. And they're hardworking individuals. My parents, or my dad and my stepmom, are both hardworking individuals. And all this stuff started piling up, having to go back for checkups due to the baby. I broke my arm. Me and my brother both broke out with severe psoriasis. I had to go to the dermatologist multiple times. I broke out with a allergy condition called angioedema. I was in and out of the hospital, and we didn't know what it was. It took forever for them to diagnose it. After all this, and in the midst of all this, bills piled up. We couldn't pay them, and then bankruptcy was the next step. We had to switch insurance companies. We're currently on Blue Cross Blue Shield, and like we said, they're about to go up 25%. And there's no reason for that hardworking individuals, or anybody for that matter, should be told that they're not worthy enough to be taken care of when they're sick or they're injured. That's unethical.
But organizers say they want to do more than simply take on healthcare companies and Obamacare.
But we didn't start a movement to be anti-Obamacare, to be anti-Care First or anti-Kaiser. We started a movement for something, and it was to remind ourselves that they're fundamental public goods, and that we understand that we need to fight to make sure that they're actually protected. And chief among them, in terms of our organization, our campaign, is that healthcare itself is a public good. You know, what we have under the ACA, you know, was something written by the Heritage Foundation, by the insurance industry, you know, by a bunch of bought-up senators at the Finance Committee, that basically maintains the private system in a way that guarantees them, you know, tons more profit now by basically doubling the numbers without necessarily ensuring that everyone gets quality care. You know, under the ACA here in Maryland alone, there's still going to be over 400,000 people without coverage. There's going to be like tens of thousands of people that are, at the very least, that are going to be underinsured, that are getting these just crappy plans, under the exchanges of like getting 60% coverage, but on top of that, you have a $3,000 deductible and you're paying $200 a month at the minimum, so it's kind of ridiculous to think that actually helps you out.
Well, we didn't have a debate during the health reform process. It was completely scripted to pass this piece of legislation that props up the health industries. And so now that the exchanges are opening and people are going to see that the market-based system doesn't work, more and more people are going to have problems affording the health care they need. Yes, we absolutely believe this is the time to organize and demand that America finally do the right thing and pass Medicare for all.
Universal healthcare advocates in Maryland say they hope to replicate a similar effort in Vermont, which will be launching the country's first single-payer healthcare system in 2017. Reporting for The Real News, this is Jessel Noor in Baltimore.